Let's move to Dr. Samer.
Thank you.
Bye-bye.
All right,
Samer Koussayer is going to talk about fake news of varicose veins in pregnancy. Ready, Samer?
Yeah, just let me find my, okay, this one. Let me share my screen. Here we go. You can see my screen, Ayman?
Yes.
Okay, first, good evening, everyone, and thank you, Ayman, for the invitation. It was great to be part of the Egyptian Venous Forum. I'm going to talk about varicose vein in pregnancy. Why varicose vein happen during pregnancy? The incidence usually about 10 to 20% of the pregnant woman. The cause usually because the blood volume increase during pregnancy. We know that during pregnancy, the plasma increase about 40 to 50%, and the red blood cell mass increase about 20 to 30%. And this can cause varicose vein to engorge with the blood. The second thing, because the compression of the IVC by the baby weight. And the third reason is the hormonal changes, because increased progesterone level can compromise the vein valve and relaxing vein wall. So what are the risk factors for varicose vein during pregnancy? Family history of varicose vein could be a major problems, being overweight or obese, carrying more than one fetus, and standing for a long period. So how we can prevent varicose vein during pregnancy? First, we advise the woman to avoid prolonged standing and sitting, sleep on the left side because this will take the pressure of the fetus from the IVC. We ask him also to keep their legs elevated as much as possible, maintain a healthy diet, exercise to improve their blood circulation, and don't wear a high heel if they can. And sometimes we advise them to wear compression stocking. But the question, does the compression stocking help or not? This is a nice paper. They look at the compression stocking prophylactic for emergent varicose vein in pregnancy. It's a prospective randomized controlled study. And they found really that compression stocking do not prevent the emerging of gestational varicose vein, but they are significantly decrease the incidence of long saphenous vein reflux at the saphenofemoral junction and improves the leg symptoms. So what are the 5 most varicose vein myths during pregnancy? The first one, the varicose vein don't typically show up until later in pregnancy. And this is false, really. This is a fake, because varicose vein can happen at any stage of the pregnancy. And the most common location, we can see them in the inner thigh and the calf muscle, pelvic area, and vulva, and the rectal area, they present as a hemorrhoid. The second myth is that if you already have a varicose vein or spider vein, does the pregnancy make them worse? Of course, yes. And the reason, because there's a lot of factors which increase the varicose vein during pregnancy, which we already mentioned before, like increase the blood volume, hormone changes, and the physical pressure of the fetus on the IVC. The third one, if your mom had a varicose vein, you are more likely to have them. This is also true, because genetic plays a significant role in weakening valve wall and faulty valves. And if your close family member has a history of varicose vein, you might be a higher risk for developing them. And while genetic can increase your risk, but they don't guarantee development of varicose vein. Number 4, varicose vein are more likely to happen with multiple pregnancy, which is of course true. And the last one, if you might also find another vein during pregnancy in different location. And this is true because you get spider vein, you can get chronic venous insufficiency, you can get a DVT, hemorrhoid, or you can even see a prominent breast vein. So the next question, can I treat varicose vein during pregnancy? Usually it's advised to wait at least 6 months after giving pregnancy or birth to explore the varicose vein treatment. But you can, in the meantime, to speed up the healing process for your varicose vein, which happened during pregnancy, by keep moving, change your diet, compression garment, and don't smoke, and limit your alcohol intake. So what are the treatment options? Like any varicose vein, you can do sclerotherapy, you can do laser, ambulatory phlebectomy, radiofrequency, venous seal, foam, or ligation and vein stripping. So what the nice guideline, they said, don't carry out any intervention treatment for varicose vein during pregnancy unless in exceptional circumstances. And consider compression hosiery for symptom relief of leg swelling associated with the varicose vein during pregnancy. But there's 2 still research recommendations which we don't know an answer yet for these 2 main questions. First, how long after giving the birth should a woman wait before having interventional treatment of varicose vein. We said about 6 months, but we don't have really strong data to support that. The second question, should women have their varicose vein treated between pregnancy or wait until they do not plan to have any more children? Also, these are controversial questions. This is a very nice paper. They look at the risk factor of the first venous thromboembolism around pregnancy. It's a population-based cohort study from United Kingdom. They found the incidence of VTE during pregnancy is 1 out of 1,600, and it considered the 7 leading cause of death of maternal death. The risk factor for antepartum VTE, it's varicose vein, multiple birth, inflammatory bowel disease, UTI, diabetes, BMI more than 30, and maternal age more than 35. And they found that postpartum VTE risk about 2 to 5 times than of antepartum, and C-section and birth complication increase the risk of VTE. What about superficial vein thrombosis? Usually it's increasing, when you have SVT during pregnancy, it's being considered as a marker really for systemic risk for more serious VTE event than just an SVT. And it's potentially more difficult diagnosis because it's very common complaint of limb swelling and limb pain, a shock of breast during pregnancy. So sometimes can go under notice. And any patient with SVT in pregnancy really should be treated as a high risk for VTE. And this is very important. So how we treat SVT during pregnancy? If it's uncomplicated, if it's less than 5 centimeters in length, there's no deep venous involvement by ultrasound, low risk patient, then symptomatic care with reassessment in 7 to 10 days is advisable. But if patient has a complicated one, like she has ultrasound, show the DVT, then you have to give her full anticoagulation. If you find a thrombus and SVT more than 5 centimeters or within 5 centimeters from the SFG, then they're going to give anticoagulant. Dose and type of anticoagulant for SVT is undetermined, but most guides suggest him to give intermittent dose of heparin, like enoxaparin 40 milligram sub-Q QD for low risk patient. But if patient high full risk or she has a DVT confirmed by DVT, then you have to give a full anticoagulation. The treatment duration is, again, it's controversial, but most people give to 45 days or until the symptoms resolve is common. So conclusion, SVT is generally a worse actor than has been traditionally thought. More DVT at time of presentation and more progression to DVT or PE immediately after diagnosis. So we have to take SVT really seriously during pregnancy. Pregnancy is highest condition for VTE with a high association death rate. Any pregnancy-related VTE is treated aggressively. And in consultation with obstetrician, try to treat SVT with intermittent heparin-based anticoagulant if patient has uncomplicated SVT, but full anticoagulation in complicated or high-risk women. Thank you very much for your attention.
Thank you, Samer.
Any question?
Sure. But before questions, we will fly all the way from Saudi Arabia to Latin America and welcome Chantal Guerrero. Ready, Chantal, for your comment?
Yes, Ayman, I think it's very interesting, and this topic is quite important, especially being a woman. And I want to see the pregnant woman in 3 different times and see in their life. I think the past is important because we have to know, as Dr. Samer mentioned, the family history, if they have some fertilization treatment, hemorrhoids, other veins. If she's obese, of course, it's very important in the past. And some fake news that I always see in the past of a pregnant woman, if she waits a long time before she starts treatment. If she has to